My name is Natalie Oxley, and my presentation is on urinary tract infection treatment. This is for advanced pharmacology in the fall of 2022. The main resources I used to find my guidelines were the American Academy of Family Physicians and the Infectious Diseases Society of America. The usual culprit of UTI is E. coli, so it's important for us to treat accordingly with the appropriate antibiotics. All of the antibiotics in this presentation are used for uncomplicated UTIs. A urinalysis can diagnose a UTI, but a urine culture can be utilized to identify the exact culprit. That way, once the urine culture results, whatever antibiotic is being used for treatment can be changed if needed based on the culture result. First-line treatment for a UTI includes nitrofurantoin, also known as macrobid, or TMP-SMZ, also known as Bactrim, or fosfomycin. All three of these drugs are favorable choices due to their minimal resistance and the benefit highly outweighing the risk. Nitrofurantoin is a nitrofuran antibiotic, and it collects in the urine and kills bacteria present in the urinary tract by stopping the production of nutrients needed for the bacteria to survive. TMP-SMZ is a combination antibiotic that works to inhibit steps in the synthesis of tetrahydrofolate. These two drugs work together to potentiate each other's effects. Fosfomycin works to inhibit cell wall synthesis, therefore killing the bacteria. Second-line treatment. This would include fluoroquinolones such as ciprofloxacin, levofloxacin, and ofloxacin. Though these drugs are effective, they come with the risk for more severe adverse effects such as tendon rupture, so these antibiotics should be reserved for more serious infections. I thought this was a really good chart because it showed you the first-line treatment and second-line treatment, as well as the dosage for each antibiotic and the frequency, as well as the pregnancy category. So for the different pharmacodynamics and pharmacokinetics of each antibiotic, nitrofurantoin injures bacteria by damaging the DNA. It collects in urine and kills bacteria present in the urinary tract. Bactrim is a combination antibiotic that works together to potentiate each other's effects by inhibiting steps in the synthesis of tetrahydrofolate. Fosfomycin inhibits cell wall synthesis to kill bacteria. And fluoroquinolones work by disrupting cell division and DNA replication. Different antibiotics can produce many different effects on our body systems. So to start with nitrofurantoin, it has many GI effects, such as nausea, vomiting, and diarrhea. These effects can be managed by administering the antibiotic with milk or meals. This medication can also cause pulmonary reactions, hematologic effects, peripheral neuropathy, hepatotoxicity, and birth defects. Bactrim is usually well tolerated and toxicity is rare, but the most common adverse effects are nausea, vomiting, and rash. This combination medication can also cause hypersensitivity reactions such as Stevens-Johnson syndrome, renal damage, anemia, hyperkalemia, and birth defects. Fosfomycin, the most common adverse effects are diarrhea, headache, vaginitis, and nausea. Fluoroquinolones, these medications have a black box warning for tendon rupture, so it's very important to note that. They also have some GI issues and CNS effects such as headache, dizziness, and confusion. Some other factors to consider. The cost of antibiotics can be reduced by factors such as GoodRx. Another thing to consider is that compliance may differ with different antibiotics due to dosing schedules. So for example, nitrofurantoin is given twice per day for 5 days, Bactrim is given twice per day for 3 days, and fosfomycin is given as a one-time dose. So, it is important to take your patient's daily schedule into your consideration when you're prescribing your antibiotics. That way they will be the most compliant, so it'll benefit them in the best way it can. Some considerations for special populations. So for children, fluoroquinolones should be avoided due to the risk of tendon rupture. Nitrofurantoin is contraindicated in infants less than 1 month old. Bactrim is to be avoided in infants less than 2 months old. Pregnancy and breastfeeding considerations. Nitrofurantoin is contraindicated in the 3rd trimester, and fluoroquinolones should be avoided in pregnancy altogether. Breastfeeding is to be delayed until 4 to 6 hours after a dose of a fluoroquinolone. Bactrim is contraindicated in breastfeeding and in the 1st trimester of pregnancy and when near term, and that's due to its mechanism of action. Hepatic and renal disease considerations. Fluoroquinolones, nitrofurantoin, and Bactrim. All of these, the use is cautioned in patients with renal impairment. Dosage adjustment may also be needed depending on the patient. Elderly patient considerations. Ciprofloxacin may cause confusion or psychosis, and with fluoroquinolones, tendon rupture is also a concern in this population. And these are my references.